Do you ever feel like the world around you is too loud, too bright, or just too much? Or maybe you know someone who doesn't like hugs, avoids eye contact, or lines up toys in a very specific way. That could be part of how Autism Spectrum Disorder, ASD, shows up. ASD isn't an illness or something that needs to be cured. It's a different way the brain works. People with ASD may experience the world differently, like hearing a song where everyone else hears normal sounds. For example, a child with ASD might cover their ears when the hand dryer goes off in the bathroom, not because they're misbehaving, but because it sounds painfully loud to them. It's not a choice, it's how their brain processes information. ASD is called a spectrum because no two people with autism are exactly alike. Some can speak fluently, others use picture cards. Some love routines and get upset when things change, like if their breakfast cereal is in a different bowl. Understanding ASD helps us be kinder, more patient, and more inclusive. So what causes autism? Well, scientists don't believe it's caused by one single thing. Instead, it's a mix of factors. Think of it like baking a cake. If you change the ingredients or the oven temperature, you get a different result. With ASD, the ingredients are mostly genetic. If a brother or sister has autism, the chances are higher that another sibling might too. But genes aren't the only thing. Things that happen before birth can also play a role. For example, if a baby's mom gets very sick during pregnancy, or if the baby is born very early, those can increase the chance of ASD. It's important to know that vaccines do not cause autism. Many big studies have proven this. So if your friend is worried about giving their baby a vaccine, you can say no, it won't cause autism. Doctors and science agree. The brain of someone with ASD develops in a unique way from the start, like a differently wired computer that still works just in its own way. How can you tell if someone might have ASD? Well, signs usually show up early, often before age 3. For example, imagine a toddler who doesn't respond when you call their name, or who lines up toy cars in a perfect row instead of driving them around. They may not point at birds or balloons to share excitement, a behavior called joint attention. Another sign, delayed speech. Some kids with ASD don't talk by age 2 or 3, while others talk a lot, but about only one topic, like train schedules. They might repeat words they hear, called echolalia, like saying want juice when they mean I want juice. Socially, they may prefer playing alone, not making eye contact, or not understanding when someone is joking. They might get upset when a small thing changes, like the route to school. Sensory differences are common too. A shirt tag might feel like sandpaper, or smells might be overwhelming. But remember, these aren't bad behaviors. They're responses to a world that feels confusing or intense. There's no simple blood test for autism. Diagnosis is about observation and talking, kind of like detective work. Doctors and specialists will watch how a child plays, talks, and acts. They might ask parents questions like, does your child enjoy being bounced on your knee, or do they wave goodbye? Tools like the ADOS, Autism Diagnostic Observation Schedule, help watch social interactions in action. If a child doesn't pretend to feed a doll, or avoids eye contact during games, these clues help. Diagnosis usually happens by age 2 to 4, but some adults are diagnosed later. Maybe they always struggled with friendships and finally learn why. Treatment isn't about fixing autism, but helping the person live comfortably. Speech therapy can help with talking. Occupational therapy teaches how to handle sensory issues, like using weighted blankets to feel calm. Behavioral therapy, like ABA, helps learn new skills, but should always respect the person's feelings. For example, if a child hates eye contact, therapy should focus on connection, not forcing a behavior that feels wrong. Early support makes a big difference. Can we prevent autism? Not really, because autism is part of how a person's brain grows from the very beginning. It's not like a cold that you can avoid with a vaccine. Since genes and early brain development play the biggest roles, we can't change those. But we can prevent harm. For example, making sure moms stay healthy during pregnancy. Eating well, avoiding alcohol, and getting prenatal care supports healthy brain development. Avoiding certain medicines or chemicals during pregnancy might also help lower risks. But remember, autism isn't something to fear. It's not a tragedy. So instead of trying to prevent autism, many experts say we should focus on preventing stigma. For instance, teaching schools to include autistic kids warmly instead of pushing them to act normal. Prevention isn't about stopping autism. It's about building a world where everyone, including autistic people, can thrive. Science keeps learning more about autism every year. One cool advance is that researchers are finding patterns in brain activity and genetics. For example, some studies use eye tracking to see that babies who later develop ASD may look less at people's eyes as early as 2 months old. This could help diagnose autism much earlier. Another advance is better understanding of the autistic strengths, like attention to detail, deep focus, and honesty. Companies like Microsoft and SAP now have hiring programs for autistic adults, knowing they can be amazing at jobs like coding or data checking. Tech tools are also helping. Some apps use pictures or speech-to-text to help non-speaking people communicate. Recently, scientists are also shifting from trying to change autistic people to supporting them as they are. For example, instead of forcing a child to make eye contact, they teach communication in ways that feel safe. This is called the neurodiversity approach, celebrating different brains, just like biodiversity in nature.